Good day, everyone. Again, this is your nurse Edwin, and this time I want you to gain a better understanding about blood pressure. Hypertension and hypotension, more commonly known as high blood pressure or low blood pressure, are common conditions that affect a very large percentage of people in the United States. I think it's not only in the United States but probably around the world. High blood pressure, which is more of a problem than low blood pressure, affects over half of adults in the United States. It is a widespread problem where lifestyle, genetics, medicine, and some environmental factors can cause people to have trouble staying within the healthy blood pressure range. Low blood pressure, on the other hand, while more desirable than high blood pressure, can cause problems if the numbers drop too low. The same factors that contribute to high blood pressure, like lifestyle, genetics, and some environmental factors, can be the same culprits that cause low blood pressure. Let us explain about blood pressure. Blood pressure, guys, is a measurement of the force of the blood pushing against the arteries as the heart pumps it through the circulatory system. It is called a blood pressure chart. So, this measurement is given in a number, or more specifically, a number over a second number. This is how they do it. The number could be written as 120 over 80 millimeter mercury, and it would be pronounced as 120 over 80. Now, the top number is known as the systolic pressure, and the bottom number is known as the diastolic pressure. The top number is a measurement of the highest pressure as the heart pumps blood, and the bottom number is a measurement of the lowest pump as the heart relaxes. So, the recommended healthy range for systolic and diastolic measurements is from 90 over 60 millimeter mercury to 120 to over 80 millimeter mercury. These measurements are recommended for everyone regardless of age, race, or gender. Blood pressure, guys, these numbers can fluctuate daily. But having a blood pressure outside of their recommended range on a long term basis can have serious negative consequences on a person's health without them even knowing that is happening. Some of these consequences are the following. Number one, brain damage, such as mild cognitive impairment or even dementia. Second, damaged arteries, which can lead to aneurysm, strokes. Some people you would notice that they have like hemorrhagic stroke because of this condition. Heart damage, such as enlarged left heart or coronary artery disease. Heart attack, which could be fatal. Kidney damage or kidney failure. Now, let's discuss about low blood pressure. Low blood pressure is usually only a problem if it has symptoms with it or if there is a sudden drop in blood pressure. This can be especially true for elderly patients because proper blood flow to the heart could become a problem. A sudden drop can be detected if a person is lightheaded, dizzy, or passes out. Now, allow me to discuss this time the stages of high blood pressure. In most cases, high blood pressure is much more dangerous than low blood pressure. There are actually five levels of high blood pressure. The first level is normal, with the pressure being less than 120 over 80. The second level is the elevated, which is when the systolic is between 120 and 129, but the diastolic is still 80 or less. The third level is the stage 1 of high blood pressure. This is when the systolic is 130 to 139 and or the diastolic is 80 to 89. Stage 4, the number 4 level of high blood pressure is the next level where the systolic is 140 or higher and or the diastolic is 90 or higher. The last level, which is the most dangerous, is what we call the hypertension crisis. This is where the systolic is 180 or higher and or the diastolic is 120 or higher. So if the person reaches hypertension crisis, it is imperative that they get to a doctor immediately because they could have a stroke at any moment. Now, let's discuss about the common causes of high, low, and sudden drops in blood pressure. We have to remember that there are many different things that can cause issues and changes to a person's blood pressure. Let's first discuss about high blood pressure causes. Number 1 is smoking, obesity, genetic causes, sleep apnea, eating high salt diets or foods, illnesses, lack of physical activity, thyroid problems, chronic kidney disease, and even old age. For low blood pressure causes, on the other hand, some causes probably would attribute to the low blood pressure are medication, pregnancy, hypothyroidism, hypoglycemia, diabetes, heart issues, liver disease, and even heat exhaustion. Now, what are the causes of sudden drops in the blood pressure? It could be a loss of blood, extremes in body temperature, and it could also be from the medication that the patient is taking, dehydration, sepsis, anaphylaxis, and heart disease. So that's all for now, and I hope I was able to again share with you a very important nursing knowledge that you can apply at the bedside while taking care of your patients. This is again your nurse Edwin saying thank you for listening.